Triniti Skin Series, the complete skin program for immediate, visible, and long-lasting results. Triniti is a treatment in 3 steps, performed sequentially during the same visit. The 3 treatment technologies of the Triniti Skin Series, SR/SRA color correction, skin tightening, and the Motif IR fractional for wrinkles, feature the revolutionary ELOS technology, a combination of bipolar radio frequency and optical energies which precisely heat tissue within the targeted treatment area to stimulate improvement within the skin. With the Triniti Skin Program, color correction, wrinkle treatment, and focused dermal remodeling can all be achieved in a single session. Step 1. SR/SRA for color correction. Treatment with the SR or SRA. The skin rejuvenation application targets both red and brown lesions for skin tone rejuvenation. The SR or SRA applicators are intended for treatment of benign, pigmented, and vascular lesions. The applicators are optimized to emit light in wavelengths selectively absorbed by hemoglobin and melanin. The targeted lesions absorb the light energy, raising the temperature of the target tissue. Then, RF energy flows to the heated area and elevates the temperature to the level required for effective treatment and overall improved skin tone. The skin rejuvenation applicators work to simultaneously even out skin tone and improve skin texture by lightening pigmented lesions, such as lentigines caused by sun or age, freckles, or other benign pigmented lesions, lightening vascular lesions, such as telangiectasia, rosacea, cherryangiomas, or diffuse redness, improving skin texture and elastosis, fine lines, enlarged pores, and superficial acne scarring. Treatment can be performed on the face, the chest, the hands and arms, and any part of the body that has been damaged by the sun. The clinical procedure. Remove all jewelry from the patient. Use protective eyewear for both the operator and patient. Apply gel. Choose parameters for each patient according to the recommended guidelines. Perform a few test spots on the side of the face and wait to assess the response. Positive treatment endpoints are color changes. Pigmented lesions should darken. Vascular lesions may change color or disappear, indicating that the energy was sufficient for treatment. After setting the proper parameters, start treatment. Place the applicator firmly on the skin surface with full tip contact. Then press the trigger. Wait for the beep and move to the adjacent spot, overlapping 20 to 30%, and repeat. Continue until you've treated the entire face. If the lesions have not reached endpoint and the skin response allows, perform another pass on the lesions. General skin response of slight erythema and/or edema is acceptable. The treatment may be performed in any area with photo damage. Here we see treatment of pigmented lesions on the hands. Post-treatment cooling of the area is beneficial, as is applying a topical soothing emollient. Feeling a heat sensation for a few hours post-treatment is normal. The treatment protocol is typically 3 to 5 treatments at 3 to 4 week intervals. Maintenance treatments can be performed when necessary. These are some clinical results of the skin rejuvenation treatments. Step 2. Sublime for wrinkle reduction. The Sublime applicator is intended for wrinkle treatment. Collagen and elastin depletion in the dermis result in the loss of dermal volume, creating laxity and sagging of the skin. The Sublime procedure stimulates long-term collagen synthesis. The procedure uses a combination of gentle infrared light and bipolar radio frequency to provide deep thermal heating up to 3 millimeters in depth. Treatment procedure. Remove all jewelry and use protective eyewear for both the operator and patient. Mark vector zones on the face with a white eye pencil. Apply gel. Set the treatment parameters according to the treatment area. On thick skin, use the maximum RF energy. On bony areas, thin skin, or near the eyes, use the sensitive mode or lower the RF energy. Place the applicator firmly on the skin in a perpendicular orientation, ensuring complete contact. Place the trigger and wait for the beep. Then, slightly lifting the applicator, move it to the adjacent spot, overlapping 50%, and continue until you've treated the entire zone. Move in a ladder-like manner. For faster coverage, use the auto mode. Move the applicator with the RF electrodes parallel to the direction of desired skin tightening, as shown here. Treat the first zone with consecutive passes until heat is felt, usually 150 to 200 pulses. Mild edema and erythema are acceptable. Move to the next zone and treat in the same manner. The treatment protocol is typically 3 to 5 treatments at 3 to 4 week intervals. Maintenance treatments can be performed when necessary. The Motif IR applicator. The Motif IR applicator is intended for non-invasive wrinkle treatments. It utilizes fractional ELOS technology, a combination of bipolar radio frequency energy and diode laser energy to penetrate into the deep dermis down to 2.5 millimeters. The Motif IR applicator has 2 treatment modes: the wrinkle treatment mode, done with a pulsing technique, and the texture mode, done with a gliding technique. The clinical procedure for wrinkle treatment. Remove jewelry. Define wrinkles for treatment. Treat only on wrinkles and skin depressions. Use protective eyewear for patient and operator. Apply gel to the wrinkles to be treated. Position the electrodes in a parallel direction to the wrinkle. With each pulse, pre- and post-cool with the applicator tip for 1 to 2 seconds. Treat with 10 to 20% overlap. Perform 1 pass on the target areas and assess the results. If necessary, and if skin response allows, retreat the same wrinkles or depressed lesions after 30 to 60 seconds. During these intervals between passes, you may treat another lesion and continue treatment alternating between both lesions until endpoint. Perform 3 to 5 passes on the lesions. On deeper wrinkles, folds, or skin depressions, up to 3 additional passes may be performed if skin response and patient's tolerance allow. On bony areas and thin skin, such as neck, forehead, or periorbital wrinkles, use the sensitive mode or lower the RF energy and perform a maximum of 3 passes. The endpoint is when edema causes the wrinkle to appear less deep. The clinical procedure for texture treatment. Define areas that need texture improvement. Treat each area separately. Choose parameters for each patient according to skin type and treatment area. Apply gel. Choose the recommended energy limit. Place the applicator firmly on the skin and treat with continuous gliding motions, maintaining firm contact with the skin at all times. The patient should feel an accumulating heat sensation with each additional pass. Cover the area with cross-hatched passes until the patient feels heat or until reaching the recommended energy. Do not stack pulses. The treatment protocol is typically 3 to 5 treatments at 3 to 4 week intervals. Maintenance treatments can be performed when necessary.